Hello, welcome, good evening, everyone. We are back with another Ask Me Anything session. Today is the 78th Ask Me Anything session, and we have a very senior obstetrician and gynecologist with us today. We have Dr. Singh ji from Lucknow. She's a senior obstetrician and gynecologist, as I mentioned. She's associated with King George Medical University in Lucknow. She's also a professor in the Department of Obstetrics and Gynecology there. Um, Besides being a PG program teacher, she has done the master training for many programs in the associations like FOGSI, SIFPSA, and PPTCT, etc. So today she is going to give us some details about RH negative pregnancy for the first 10 minutes. And please feel free to ask all your questions in the comment box, and Dr. Singh ji will take them soon. We're very happy to have you today live with us, Dr. ji. Welcome to iMumz Ask Me Anything session.
So, namaskar everybody. This is a very interesting platform, and here I have an opportunity to speak to you about RH negative pregnancy. So basically, whenever somebody says, "Do you know about yourself? Anything about medical aspect of yourself?" I think everybody knows what is my hemoglobin, and then everybody knows what is my blood group. So we all know broadly that my blood group could be A or B or AB or sometimes O. But then there is something more finer than this, and that is that along with that, we could be what we call as positive or negative, depending on a very typical antigen, which is called as RH antigen present on our RBCs or not. So broadly speaking, you may be A positive or you may be A negative. Probably in rest of the phases of life, it does not matter much whether you are positive or negative. But during pregnancy and for your family future, it does matter a little bit. So it happens like this, that if a woman is RH negative and her partner is RH positive, and then in her womb, if she is carrying an RH positive baby, then in that RH negative mother, few chemistry things may be typical and which may be of a little concern to her growing baby and when that baby is born. So it happens like this, that when you are RH negative and the baby growing inside you is RH positive, courtesy your husband's RH positivity status. So then some antigens cross over from your baby's body into your body and you start producing what we call as antibody. Well, in simple language, it is that we start reacting to the blood group, that the mother starts reacting to the blood group, and then these antibodies can go back into the fetus and cause problem. So you must have heard that in layman's language, if somebody has been given a wrong matched blood, then there is a problem. So here also something like this happens, that antibodies cross over to the baby growing inside, and then the baby starts developing problem. These problems usually in the first pregnancy are not serious, but in second or subsequent pregnancy, when the mother has already been sensitized, the antibodies can increase in amount, and then baby can have problems like baby can develop anemia, baby can develop swelling all over the body. Sometimes the baby may be born with lot of jaundice, and sometimes there be heart failure, etc. in the babies also. Hence, it is very important to be aware of your blood group before you are going in for a pregnancy. And just in case you have RH negative blood group, you get tested. And if your spouse is RH positive, then accordingly you have to take precautions. The precautions are very simple. There are injections available which protect your growing baby inside and later on subsequent pregnancies. And these injections have to be given during pregnancy and after the birth of the baby. These are anti-D injections which prevent this sensitization and prevent formation of those antibodies which can harm your baby growing inside you, or when the baby is born may not have problem, these can be harmed. So hence it is very important that the moment you are going first time for your pregnancy registration, you must have all the investigations done. Usually, routinely, in every antenatal case, in the first group, in the first visit only, the blood group and RH typing would be prescribed to you, would be asked to be done for you. And then, if you are RH negative, do keep in mind, do tell your doctor that I'm RH negative and protect yourself. It is also important that this precaution, that is giving of this injection, has to be done even if you are having abortion, or by chance you have an ectopic pregnancy, or you have bleeding during pregnancy, etc. Then also these precautions have to be taken. However, having said all this, I must tell you that now we have got very good insight into the problems which can happen due to somebody being RH negative. And there are easily available investigations by which it can be found out whether the mother is developing antibodies and whether the effect on the baby growing inside has started or not. Like simple test in mother's blood, just a milliliter of blood being taken and set for testing can tell you whether you have started developing these antibodies or not. So once somebody is RH negative, then immediately this test is done to find out whether the mother has been sensitized, whether she is producing antibodies or not. And also ultrasounds are done at regular interval to find out whether the baby has been affected or not. For example, if the baby develops a lot of anemia, or the baby develops edema, swelling all over the body, the ultrasound can tell you all this. Subsequently, severe anemia leads to changes in the blood flow in the baby, condition of the heart of the baby, and those also can be easily studied by Doppler ultrasound. Doppler, we know, is during ultrasound when blood flow studies are done. By that, this can be estimated. After that, delivery has to be conducted at specialized centers, that is tertiary care centers, or where the facility is there to take care of the newborn, which may sometimes be premature. And also, if sensitization has occurred, if these babies are born with anemia, that is less of hemoglobin, or jaundice, that is more of bilirubin, jaundice, then there should be facility available for taking care of all these. Easy facilities, simple management methods are there by which most of the advanced neonatology centers, that is those attached with the medical colleges, those attached with the tertiary hospitals, tertiary level centers, everywhere these facilities are available. It is rarely that a mother ends up with a sensitized situation in such a manner that before the baby reaches, say, about 9 months, inside the uterus, lot of complications have already occurred. In those situations, of course, the mother has to go to very advanced fetal medicine centers where treatment is done when the baby is inside the uterus itself, in the form of giving blood transfusion inside and some drugs, so that the ill effect of this complication which has occurred does not occur. So in nutshell, a pregnancy, if occurs in an Rh negative mother where the spouse is Rh positive and possibility of the baby being Rh positive is there, needs special care in the form of timely tests, blood tests and ultrasound examinations, routine, a good antenatal care, prevention of complication by giving anti-D injection during the pregnancy, which is one given at about 28 weeks of pregnancy, and second injection being given after the delivery if the baby has been found to be positive. And in each pregnancy or any event of pregnancy like abortions, ectopic, etc., also this prophylactic or injection which prevents complication has to be given. Important is that one must not ignore Rh negative status, and one must not ignore the advice which has been given about this situation. It is required that whenever you go to a center, you inform them in advance that you are Rh negative and find out from the doctor whether all the facilities are available or not. And after that only, choose your center for delivery. There is a little bit of cost involved because these injections are slightly expensive, but then they are not so expensive, as expensive that you cannot afford it. And above and all, in all government institutions, these injections are available. So anybody can go there and take these injections there. They are available free of cost or are available under the various government schemes of Janani Suraksha Yojana, Janani Shishu Evam Matritva Suraksha Yojana, etc. They are available in all hospitals at no cost to the mother, and she can easily avail these facilities.
Thank you so much, Doctor, for this wonderful explanation. We have many questions people want to ask from you. Shall we start taking questions?
Yeah, sure.
Okay. Firstly, Dr. Jaideep Malhotra and Dr. Niharika Malhotra are also watching this live. They are wishing you, and Dr. Jaideep ji is welcoming you for this session. Thank you so much, Doctor. Yeah. The first question of the day, it's from Simran. Can we get pregnant in PCOS? Can we get pregnancy in thyroid?
The topic for discussion today is RH negative, but yes, definitely, if somebody has PCOS, the pregnancy can occur without any doubt. PCOS is a very peculiar problem. It occurs nowadays very frequently. It is a very problematic thing also, right from adolescent to elderly age group. But thankfully, as far as obstetricians and gynecologists are concerned, PCOS is one problem where there are adequate, ample number of medicines available, medical methods available, after which pregnancy thankfully can occur very easily. And once the pregnancy occurs in a patient who has been PCOS, some amount of a little bit of medication is required, little bit of extra care is required. Otherwise, usually pregnancy takes a normal course and the women has a normal outcome also. Now, as far as thyroid abnormalities are concerned, the commonest is having hypothyroidism, which again is a very correctable problem. And with small medication, this can be corrected. But yes, we must remember, if thyroid levels have not been corrected, then there can be adversities during pregnancy in the form of higher chances of abortion, more chances of baby having some anomalies, and then baby having neonatal problems likewise. Now, connecting it to RH negative, it does not make any difference. The course is same.
Thank you, Doctor. Next question by Neha. She's 8 weeks pregnant. Can she eat milk powder and plum cakes?
Milk powder and plum cakes. Somebody is 8 weeks pregnant. Oh yes, most welcome. Please go ahead. Enjoy your plum cakes as much as you like.
Thank you, Doctor. Next question by Richa Chavla.
Check on your weight. Yeah.
Next, thank you, Doctor. Richa Chavla's question is 13 weeks and 33 years old. She took the dual marker test in that Down syndrome, and then, but NT was normal. She took the latest for dual marker. Then the result is again normal. What should she consider?
So absolutely fine. If you have got the screening at this age by both dual marker and the NT-NB scan, then rest assured your pregnancy for this aspect is fine. You don't have to get anything more tested. Go with your routine pregnancy testing and routine scanning.
Thank you, Doctor. Neha is thanking you for the answer. Next question by Atanu Chakravarti. She's 24 weeks pregnant. So she's Tama Chakravarti. She had a viable intrauterine pregnancy with fetal heartbeat of 160 at 15th week, but a spontaneous abortion occurred on 16th week of pregnancy. The baby was still alive. Why this happened? She had no BB, sugar, or prior miscarriages.
Well, this is a tricky situation. You know, as we advance in the science, we learn a lot of things. We have more knowledge. We know many things, but then there are still so many things about nature we do not know. Now, what we call it, what you have had is an unfortunate abortion in second trimester. All right, first trimester means losing a pregnancy within first 3 months. What you have was initially what was a viable pregnancy that the baby was there, cardiac activity was there, and then you lost that pregnancy. This, at this gestational age, we say that this is abortion in second trimester. Well, there are many causes which are known of abortion in second trimester, but then there are many things we do not know. So possibilities are that whenever there is an abortion in second trimester, the causes could be that there are some congenital there is some malformation in the uterus, there is some weakness of the cervix which has occurred, there may be some problems related to the infection having occurred, some anomalies in the uterus may be there. There may be some problems associated with her thyroid status may be there, even though the blood pressure and blood sugar, as you said, are all right. Infections is very important cause where some intrauterine infections, secondary to urinary tract infections might have occurred where the pregnancy did not continue. Endocrinal issues are also there. Thyroid, as I mentioned, is very important of that. There may be some placental abnormalities which could have been there due to which the abortions occurred. Well, now that if it was first time which had occurred, then yes, there would be set of investigations which would be advocated. But I must tell you that it is not necessary that investigations would be able to tell you everything about it. However, go and take consultation from an obstetrician, they would be able to tell you. Having said that, let me assure you that abortion in first pregnancy, if it was the first pregnancy, is a very common thing. It occurs to as many as 10% of total pregnancies, and subsequently these women or everybody has a high chance of having normal pregnancy also. So it should not worry you too much, but yes, the requisite investigation should be done.
Thank you so much, Doctor. Next question we take from Swati Bishwas. She is 12 weeks pregnant and she's diagnosed with subchorionic hematoma, volume 1.4 cc anteriorly. FHR is 174, CR is 58.1, placenta is posterior.
Okay. So yes, there is a small hematoma, which means a small amount of blood has leaked below the placenta, between the placenta and the uterine wall. It is a matter of concern, but not of grave concern. Actually, if you see, a lot of times there is a little bit amount of bleeding. The blood collects there. The size which you have mentioned is within the margin that it can resolve on its own. With the baby still being alive, the chances are that subsequently it would resolve on its own and the pregnancy would continue. However, you have to take precaution that do take a little bit of rest. With the advice of your obstetrician, she can give you some drugs which can keep your uterus further relaxed. And after this hematoma, the blood gets absorbed, no side effect or no complication is left behind. So, not much to worry, but yes, it's a small bit of concern. Take care of yourself. Do consult your obstetrician.
Thank you, Doctor. Next question we take from Sonal. She's 8 weeks pregnant and during the bed rest, she's feeling abdomen tight and she used a laxative as per doctor, but still the abdomen is full and feeling tight.
Okay, so probably she means that she has something like incomplete evacuation of bowel. That means motion is not clear, and something like constipation she's having by what you are saying. So remember, during pregnancy, it is normal that you have a little tendency of getting constipated. That is because of hormonal changes which occur during pregnancy. It especially gets aggravated in those people who either have a tendency for constipation or have a little bit of irregular food habits. In them, this problem is a little more prominent. So what I would advise is that become regular about your food habits. Of this, first and foremost is do take good amount of water and liquids. Secondly, take food which has got more roughage. Roughage in the sense, like we always say, that take a lot of fruits, take salads. Those things help a lot. Take regularly fruits and salad in your meal. Take liquid, lot of that. And then I still remember old time methods, like taking warm milk, taking lime in warm milk. All these also help in improving your bowel function. Besides that, sometimes you do need medicines to help. Remember, when you have laxatives, do take care that they should not be strong laxatives. That is, do take advice of your obstetricians before you start on laxatives. And then mild laxatives can be taken, but it is better to change your diet habits rather than getting addicted to laxatives. As the pregnancy advances, the problem would persist or get aggravated, so it is better to improve and change your diet habits. Otherwise, it is usually not a matter of concern.
Thank you so much, Dr. Harsha's question. She's 13 weeks pregnant and she's feeling weakness and temperature going up and down. What should do? What to do?
Mention of temperature in these days is actually, a matter of concern. So good that you are 13 weeks pregnant. That means you have crossed your first trimester. Well, temperature during pregnancy usually is not because of pregnancy. So when somebody has temperature, then the causes are same as somebody has temperature without having pregnancy. So there are innumerable causes of fever that may be there. So first foremost, monitor your temperature yourself. Do not just go by the feeling that I'm feeling feverish. During pregnancy, sometimes normally person starts feeling feverish. That feeling is there that I'm feeling warm, but actually fever may not be there. So first and foremost, pamper yourself by a thermometer and monitor your temperature at least 3 times a day, morning, afternoon and evening, and make a record. If yes, the temperature is going more than 100 degrees, lasting for a few hours in a day, then monitor the temperature and consult your doctor. The causes could be anything related to upper respiratory tract infection, or you can having urinary tract infection, or any other focus of infection may be there. So it is important that if you are, yes, till you reach your doctor, plain simple tablet of paracetamol can be taken, but not more than 1 day or 2 days. In these times, please go and consult your doctor.
Thank you, Doctor. So tomorrow, everyone, we are having a very interesting, important webinar on lactation by Dr. Anita. So it's from 4 to 5 p.m. exclusively for baby care program members. So don't forget to join. Madam, next question is from Pradeep. He asked this question inside the iMumz app. His wife is 10 weeks pregnant, and first baby is 15-month-old already. Is it normal to feed the first baby now? Like till now?
Once you have conceived again, first baby is 15 months, then it is advisable that you gradually wean off the baby. It is advisable. Why? Because as your pregnancy grows, your own calcium requirement would also increase, and then with the second baby coming, first baby has to be weaned off. It takes time also for weaning. So it is a better idea, good idea, that you start weaning off the baby. 15 months is good enough time. The baby has had the pleasure of having mother's breast milk for a long period, very safe period. So it is advisable that weaning off should be done.
Thank you so much, Doctor. Next question by Priyanka Kandelwal. Baby 4.5 month में नीचे आ जाता है. कल मेरा बेबी आ गया है, बहुत पेन हो रहा है. आ जाता है क्या? That's their सवाल. काफी पेन हो रहा है. 18th week pregnancy.
18 weeks pregnancy. So this actually is a misconception that 18 weeks में नीचे आ जाता है वाली बात है. Very, very technically, if you see, then we say that yes, the growing conception at about by 3 months of gestation occupies whole uterus, but it is nothing like baby niche aa jata hai. That is not the right time. In fact, we refer to this situation at about 8.5 months pregnancy, when we say that the baby descends down when it is about to deliver. So that is not there. In case you are having that feeling that baby is coming low, or you are feeling weight or heaviness in the lower abdomen, then you must consult some doctor, especially if you are having the pain. Very often there may be some urinary tract infection which is leading to that feeling of heaviness and pain down below, especially if simultaneously you are also having problem during passing urine. If you are having simultaneously problem in clearing your bowel, that is motion, etc., then also you need to take care. But that concept is not right, that baby moves down at this time of the pregnancy.
Thank you so much, madam. Next question we take inside the iMumz app from Sneha Agarwal. She's 27 weeks pregnant. It's her second pregnancy and she's RH negative, but still her breast size has not increased. Is it normal?
Being RH negative has got nothing to do with increase in the breast size. It's got nothing to do. You see, increase in the breast size is a phenomenon which occurs during pregnancy, no doubt. But then this is a very individual response also. Some women have a tendency to have more growth in the breast during pregnancy. Some do not have as much growth. If the growth in the pregnancy has occurred in her first pregnancy to an adequate size that she could feed her first baby adequately, lactate adequately, then she doesn't have to worry. And actually speaking, there is no medicine available which can promote the growth of the breast during pregnancy. After the delivery, yes, sometimes if the lactation is not adequate, then we do have some medicines and some diet modifications which can lead to increased lactation, all that during pregnancy. Yes, incidentally, because the relevant what we are talking about today is what she's having, that she's RH negative. Yeah. So I'm sure, I hope in the previous pregnancy, she got that prophylactic injection. And in this pregnancy also, now that she's coming nearer to 28 weeks, please do take your injection, second injection. And in case you have not had your tests to find out whether antibodies are there or not, please do get them tested, especially because of COVID and everything and else, people have not had their adequate antenatal care. So it is time to pay more attention. Listen to these, online communications where you can learn.
Thank you, doctor. Next question by Vasudha. She's 19 weeks pregnant, O negative blood group. The husband is B positive. During the NT scan, the doctor said ICT negative and told her to investigate a 20-week USG scan. What is your advice?
Yeah, absolutely correct. So now that she is negative and her husband is positive, very rightly, ICT, that is indirect Coombs test, has been done to find out whether she already has antibodies or not. ICT is negative is a good news that she does not have antibodies. That means in this pregnancy, the baby is fairly safe. All that she has to do is that get regular monitoring, checking of ICT at 20 weeks again, checking by ultrasound whether baby is getting affected, if by chance. Usually the chances are that the baby would not be affected, and then continuing with this monitoring system and getting anti-D prophylaxis at 28 weeks and taking care that delivery is also there in the institutional. So I'm sure you are in good hands and getting good advice. Do remember, being RH negative is not a curse or any disease or anything. It's just that an issue that if you are RH negative and if your spouse is RH positive, then you have to take precaution.
Thank you, doctor. Next question by Rachana. She mentioned that her stomach is beating continuously. She missed the period this month. Please help her to figure out.
No, I didn't get the word. She has missed her period and then
Yeah,
she's having bleeding.
right. I think it's her stomach is paining continuously. She missed the period this month. Please, sir.
Uh-huh. Uh-huh. So she missed her period. Quite likelihood that she has pregnancy. Now, normally, whenever pregnancy occurs, you confirm it by doing first a urine test and then go for consultation with the doctor. Um, in about 90 to 95% of times, the pregnancy occurs inside the uterus, and then little bit of pain may be there, but it is no cause of concern. However, sometimes, rarely of course, the pregnancy occurs, but it occurs outside the uterus in the tubes, etc. That is the place where it should not have occurred. And in those situations, the pain occurs maybe there, and it sometimes may be severe and produce complications. So, if the pain is there, then you must consult a doctor. If the pregnancy is confirmed to be a viable, that is normal pregnancy inside the uterus, you would not be, I mean, there should not be chances of many complications. Small medications would be advised and it would be adequate. However, if there is any bleeding or episode of fainting or severe pain, please rush to your doctor in hurry. Do not bother that facilities are not open or you are scared of contracting infection, etc. At this time, please reach out to a doctor.
Thank you, madam. We wish you all the best, Rachana. Next question by Vaishnavi. She's in her 13th week of pregnancy and she likes Cerelac a lot. So can she eat once in a while? Is that okay?
Buy shares of Cerelac because you are eating and your kid would also be eating and you are liking it so much. The kid is going to like. I know I have got grandchildren, and not just the grandchildren, but her father also loves Cerelac. So I don't think technically there is any harm in eating Cerelac. You can enjoy the Cerelac, of course, but remember, after all, the food has been made for kids, so it is not going to be of much nutritive value to you. Once in a while you can relish and enjoy, but please leave it for your kids.
Thank you, doctor. Next question we have from Swati Bishwa. She's 12 weeks pregnant. Her age is 32 and the weight is 65 kgs. She's diagnosed with, okay, I think we took this question, maybe Swati posted it again. Gayatri's question, can we shift from left side to right side slowly during the sleep? But elders in the house are telling her to sleep on the left and get up and sit straight before directly shifting or turning to the left side. She is in her 31 weeks of pregnancy, and I mean, all this because to get loops of cord around the baby inside.
Well, there is no evidence to say that this kind of shifting from one side to other leads to loops getting entangled or coming round the neck or causing any particular problem. No, as such, no. But yes, one portion is correct. That is, when you are lying on the side, if you have to get up, then get up from the side only. During pregnancy, getting up when lying straight is more difficult and it can lead to stress on the abdomen and a little feeling of pain in the abdomen. But turning from left to right is of no concern, no problem.
Thank you so much, doctor. Next question by Kumar. मैम मेरा लास्ट पीरियड 10th मई को था एंड दिस मंथ आई एम प्रेग्नेंट बट ब्राउन डिस्चार्ज हुआ 15 जून से एंड आज ब्लड डिस्चार्ज हुआ.
So see, once you have your pregnancy starting, then usually every episode of bleeding has to be taken with a little bit concern. Because normally during pregnancy it does not occur. But yes, there are some times when small amount of fresh or brown color blood may occur without having had any cause of abortion or anything. But nonetheless, any bleeding during pregnancy needs to be investigated. So what you need to do is that reach out to a doctor, get an ultrasound done to find out whether this pregnancy is viable, whether there is any amount of blood collection inside or any threat to the pregnancy if is there. So it needs to be taken care of.
Yeah. Thank you, doctor. Next question by Tazeen Sharif. Ma'am, what to do if I have diastolic notching and how can we treat it?
What is the duration of pregnancy, has she mentioned?
Tazeen, can you please mention your duration of your pregnancy week, so the doctor can answer it better? Shall we take next question till then?
Yeah,
Till
please, till she completes her. Yeah.
Gautami's question, she have done the test of HbA1c and received the report in the glycosylated hemoglobin is 7, mean blood glucose, whole blood derived 154. Will it affect the pregnancy and what are the remedies to be followed?
Remember this says that you have got for some time deranged blood sugar has been there, because 7 is definitely an indicator that there have been deranged blood sugar. Now during pregnancy, if somebody develops deranged high blood sugar, then we call it gestational diabetes mellitus. All right. If she was already having diabetes from before, then the pregnancy aggravates it and makes everything a little more dramatic and more serious. Well, having diabetes or raised blood sugar during pregnancy is of great concern, because it not only affects the mother, the pregnancy, but it definitely affects the baby growing inside you, and when the baby is born also is associated with problem. So if you have deranged blood sugar, that is, if you have got features of if you have diabetes, then you are more prone to infections during pregnancy. The liquor amount of water inside your uterus may increase. The size of the baby may also increase. Early on, there may be abortion chances are also high. And later on, when the size of the baby pregnancy grows a lot, then there may be either premature delivery or difficulty in delivery. And rarely, if the blood sugars are very, very bad, then during pregnancy itself, there may be adverse complications to the baby, or sometimes after delivery, the baby may need sugar monitoring, etc. And if somebody has been pregnant, has been having diabetes from before and has now become pregnant, then chances may be that the baby may develop certain anomalies. The head is not formed properly, or there may be heart not having formed properly, or higher chances of abortion, etc. may be there. So this is an era where more and more diabetes is occurring. Women at young age are developing diabetes during pregnancy or having from before, or this diabetes continues after pregnancy also. A lot of precaution has to be taken, care has to be taken. Go and meet your doctor, take advice. The modification in the diet would be advised by a good, very well planned diet chart would be given, where you will modify your diet, increase a little bit of exercises, and take medicine to decrease your blood sugar levels, monitor them adequately. And believe me, if you have done all this, the pregnancy outcome is nearly as normal as somebody who is not diabetic.
Thank you, doctor. Gautami's question, okay, one second. Vertiga's question, doctor gave her Betensol injection at 35 weeks and asked her to come for C-section at 37 weeks. Is there any side effect for this injection, and is it necessary to go for C-section if the AFI is 8?
So what was the injection? Betnesol injection.
Betnesol, yeah.
You said Betnesol injection.
Yes, doctor, Betnesol.
Okay. Well, okay. So remember, the C-section must have been advised for some condition which I'm not able to understand in your question. Usually C-section is advised because there is some impending problem either to the pregnancy, or where it is expected that a normal vaginal delivery cannot occur. That is an independent decision. But yes, whenever C-section is advised, then in those conditions, to make sure that baby's lungs and all other systems are well matured before surgery, corticosteroid injections are given to the mother to ensure better maturation, especially the lung maturation in the baby. Betnesol is the same injection which is given to the mother to ensure that maturity. Remember, vaginal delivery is a unique process during which the baby's systems get matured very rapidly and the baby is fit to adopt to outside. When the baby comes out by cesarean section, that natural process of stress and maturation is not there. Hence, before any elective cesarean section, that injection is advised. It does not cause any harm to the mother or the baby. After all, it is given for betterment of the baby. So don't worry about that injection at all. It is advisable that injection must be given for betterment of baby's maturity.
Thank you, Dr. Kirtana Gupta's question. She's 14 weeks pregnant. She have a heavy headache. Is it normal? Can she take headache pills?
Well, at 14 weeks, normally you should not be having headache regularly. Once in a while, an episode of headache is all right, permitted. But if somebody is having headache continuously, repeatedly, then please do get yourself checked. The common causes of headache are bad eyesight, continuous causes of stress, blood pressure being raised. They must be taken care of, and some neurological like migraine, etc. must be taken. Once in a while, if you have headache, then you can take paracetamol as a pill for headache. But if it is occurring frequently and if it is more in intensity, please do go and consult a doctor and take care.
Thank you so much, Doctor. Next question by Srividya. She's RH negative and she had a miscarriage last year. It started with a brown discharge and ended with bleeding. She had anti-D injection. Now she's again 8 weeks pregnant. She had the ICD test negative now. The doctor advised dydrobone and folic acid tablets every day and asked her to come in the 12th week. What more precautions is she supposed to take?
So look at the positive things which have happened to you. One is that you got your anti-D injection in the previous abortion. Another positive, very important thing is that your ICT is negative. That is, that injection worked, and you have not become sensitized, and you do not have antibodies already in your body. That's very positive. And thirdly, also probably you are in good hands. The doctor who has advised ICT and has advised you folic acid is perfect, and has advised you an ultrasound, early scan, and further investigations. You do not need to do anything more special than that. Once routine investigations and regular monitoring of RH negative investigations is done, you do not have to worry much. There are no extra precautions required. Apart from the normal pregnancy care like good diet, don't do heavy work, avoid heavy weight lifting, take your immunization at regular time, take your supplementations at regular time, go for little walks, enjoy the life, read everything positive, think of everything positive, and hopefully everything would be good with you.
Thank you so much, Dr. Wish you all the best, Srividya. And I hope that the baby care program of iMumz is helping you to stay positive with all the meditations, music, and
absolutely.
Mm-hmm. Yeah. Next question by Manasa Veena, sorry. She's 20 weeks pregnant, and in the anomaly scan, the baby is fine, but the cervix length is 2.5 centimeters. The doctor told her to go and get the cervical stitch to avoid the early delivery. Could you please tell if it's mandatory?
Well, does she have any? Is this her first pregnancy, or she's had any this thing earlier? Any problem in earlier pregnancy? So I would just like to know a little bit more. That is this her first? She is 20 weeks pregnant and everything is all right. So I would like additionally to know: is this her first pregnancy?
I mean, if you're watching this live, Manasavina, can you please mention quickly so the doctor can answer it better? You want to answer this question, doctor, or would you want to wait till Manasa answers?
Okay, so never mind. I will just give a broad guideline of how do we go about it. So see, if it is a first pregnancy and if you have not had earlier any abortion, etc., then this 2.5 centimeters does need a little bit of close monitoring. Probably a stitch, maybe a little bit going extra precaution, going extra. There are some progesterone medicines available which can be started and which can be continued. However, monitoring of this 2.5 centimeter would be required. But just in case if in the past she has had premature deliveries or pregnancy abortion in say second trimester, that is 4 5 months, etc., then that stitch is definitely very advisable. So with this reference, you can discuss it out and you can further go ahead.
Thank you, doctor. Angaya Kani has a question. She confirmed a pregnancy at 35th day. Today is 39th day. Congratulations. When can she proceed for the initial scan, and what kind of scan is needed? Is transvaginal scan essential?
Okay, so now that her urine test is positive, she knows that there is a pregnancy, because urine test is a very definitive method of telling you about the pregnancy. If she does not have any associated problem like bleeding or pain, etc., then she can wait till it is 6 weeks for her first scan to be done. If when you go for this scan at between 6 and 8 weeks, it has to be a transvaginal scan, because the probe put on abdomen or scan per abdominally would not be able to give you much information. So a transvaginal scan would be required at that time, which would tell you the correct date when the pregnancy started, whether the baby is viable or not, or if there is any associated problem, etc. out there. Earlier than that, there is no need to go for a scan.
Meena wants to know if she can eat pineapple in the 7th month of pregnancy. Can she eat pineapple in the 7th month of pregnancy?
Pineapple?
Yeah.
Pineapple in 7th month. Well, I have never come across any study or anything which says pineapple cannot be eaten. And unfortunately, I'm living in an area where pineapples do not grow, so never heard of pineapples not being eaten. I feel they can be eaten, but if there is a local or something like that, I really don't know. But from my side, pineapples can be eaten. They are safe fruit and very juicy and very nice fruit, so I'm sure they can be eaten.
Thank you so much, doctor. Next question by Tanvi. It's according to her last period date, she is 8.5 weeks pregnant, and in the ultrasound it shows that she is 6.4 weeks pregnant, but there is no heartbeat yet. Is it normal? The doctor asked her to wait 1 week.
Yeah, unfortunately, I would say it does not look like everything is perfectly normal. By this time, the pregnancy should have heartbeat. There are instances when actually the duration of pregnancy is not what you are thinking, what you are calculating according to your last period. Sometimes the conception may have started a little late, hence a heartbeat has not arrived, is not there, and it is. So for those situations, it is better to give benefit of doubt and wait for another week and see for whether the heartbeat arrives or not. Otherwise, in a true 8 weeks pregnancy, the cardiac activities, that is the heartbeat, must be visible in ultrasound. So your doctor has done a good job, has advised you to come back after 1 week where it would be checked. I'm afraid there may be a little matter of concern, but I think it is too early to start bothering. Just wait for 1 week and go and get your ultrasound repeated.
Thank you so much, Doctor. We wish you all the very best, Tanvi. Next question by Ekta. Her last period date was on 8th May, and the pregnancy test report, which she had on 17th June, shows at 619 HCG level. Please help her to know if the level is good.
This is tricky because offhand I really do not remember what should be the level at this gestational age. So why did you go for serum levels at this time? Was urine test not done? I really do not remember. Was the urine test done? If the urine test was positive, then it is good enough. After 8th May, 17th June, urine test should be positive, and that should be adequate. This does look a little less than what should be normal at this age, but you have caught me off this thing. I really do not remember the values. Probably it might be a little less. So get it repeated after 48 hours. If it doubles in that time, then rest assured things may be all right. If it doesn't, then it may be a matter of concern.
Thank you, Doctor. Linusha is 5 months pregnant now, and which month should she take anti-D injection before and after pregnancy? And does this have any complications for the delivery?
So anti-D injection, when you are referring to, that means you are Rh negative and your husband's spouse is Rh positive. That must be the thing. So during pregnancy, if the ICT is negative, then anti-D injection is given at 28 weeks. So 28 week matches something like 6.5 months. So at that time, this injection should be given. Another injection is given after the delivery, after checking whether the baby is Rh positive or not. This injection as such does not cause any harm to the pregnancy at all. If anything, it benefits the pregnancy by preventing the sensitization or production of antibodies in the mother, which subsequently can harm the fetus. So it is very, very safe injection. It must be given during pregnancy to avoid the complications.
Thank you, Doctor. Actually, many people were asking us about the lactation course and how to breastfeed. So for all of them, this is very, very important. And one of the leading lactation experts of the country, Dr. Anita ji, she's taking the webinar tomorrow. So don't miss that. It's a Sunday, 4 to 5 p.m. And tomorrow we have, we have many events tomorrow. Tomorrow being a solar eclipse. Just check on the iMumz app. What are the suggestions which we are showing for the solar eclipse, and we debunk many myths. You can just check it out. And tomorrow is also the International Day of Yoga, which our Prime Minister Narendra Modi ji has started a few days ago, and this is a great initiative. And we have something exciting coming up for you. Yoga is very, very important. At least breathing exercises are also very, very important. Many doctors do recommend them. And also tomorrow is the Father's Day. So all the Father's Day in advance to all the to-be fathers. And don't miss the webinar tomorrow from 4 to 5 p.m. Subscribe to the Baby Care program if you are not a subscriber yet. And see you tomorrow. Next question by Himani. She's 7 weeks pregnant. She's getting cramp in the lower abdomen occasionally. She have twin history in the family, and she feel extremely hungry for every 1 hour. What is the probability of her having twin?
Well, having twins does have a familial tendency, especially if there is a tendency on your mother's side. Your mother had twins, your sister or your mother's sisters, etc. have. There is a little bit of increased familial tendency of having twins. But just because you are having discomfort in the lower abdomen and feeling hungry at 1 hour does not mean that you have higher probability of twins. Having pregnancy can also lead to a little bit of discomfort in the lower abdomen, and with the hormonal changes occurring, one starts feeling very thirsty and very hungry from early on in pregnancy, even though at that time the baby may not be needing that much nutrition. This is a body's method of preparing for the forthcoming increased requirement which is there. To find out whether you have twins or not, It is the ultrasound only which would be able to tell you. Yes, sometimes in some people with twins, the amount of vomiting is more, and sometimes urinary problems may be more, but definitely they do not mean definitely that the twins have occurred. You'll have to go for ultrasound, and don't worry, your family has had twins earlier also. So if they are there, welcome.
Yeah. Thank you so much, Dr. Chaitra's question, she is 11 weeks pregnant and the torch IgM cytomegalovirus test is positive value and it is 1.94. What are the risks and what sort of medication can she have? Please have it.
Well, cytomegalovirus is a bad infection which occurs during the pregnancy. It is definitely bad. Please go and consult your doctor. IgM means that currently the infection is there, and these infections have a tendency to produce more chances of abortion. Congenital anomalies may also be present. So, actually, getting viral infections early in pregnancy is bad. Please go and check on with your doctor.
Yeah. Thank you so much, Doctor. Next question. Yeah, your question has already been taken. Tanvi and Srividya, please you have posted your questions again. So I suggest you to just go back and check the answers. Next question by Charu. She's having a lot of acidity with pain in the chest. She's currently in the 4th month of pregnancy. Also, the placenta is low lying. Is it related to this? She's 14th week pregnant.
Okay, so remember, uh, in during the pregnancy, it is quite common and fairly normal to have acidity, burning in the chest, etc., because of early on the hormonal changes, and later on because of the growing uterus inside the abdomen. Early on, of course, at this stage, the uterus has not grown to that size. Um, Having placenta going into reaching into the lower segment at this gestational age is not a essential thing that later on also this placenta would continue to remain in the lower segment. It is too early to say that. So in the subsequent ultrasonographies, the doctor would be able to tell you whether the placenta is growing up, what we call it migrates up or not. At this gestational age, it should not cause any concern to you. It is only when after say 28, 30 weeks placenta remains down below, then we are worried. More often than not, what is seen low down below at this time would migrate up and there would be no cause of concern. To the second part of your question, definitely the burning and all is not linked to this placenta being down below.
Thank you so much, Doctor. Someone with the handle Ash, I can't see your question. I'm taking questions in the order. I'm really sorry if the question got deleted due to technical error. Please post it and we'll try to take. And actually, it is 7:02 p.m. And thank you so much, Doctor, for patiently answering all the questions and taking them and helping all the pregnant women out there. It's so nice. Thank you so much for spending your time. And still, but there are so many questions which people want to take you, and it is not possible to answer everyone in the given time we have. Yeah. So thank you so much, everyone, for joining. Yeah.
So
Please, Doctor.
I would just like to thank you and Dr. Jaideep and Naren Malhotra for giving me this opportunity. It's a wonderful platform. We interact with doctors a lot, but being able to interact with people, with women who are pregnant, it was my pleasure. Thank you so much.
Thank you so much, Doctor. Pleasure is all ours. If you missed your question, please post in the iMumz feed section. And we are a small team, but we're really, really trying hard to answer each and every one of your questions. We answered more than 13,000 questions since this pandemic started, this corona pandemic started, and we are really, really trying to answer your questions. And don't miss the lactation session tomorrow. It is very, very important, and it is one of the top experts of the country, Dr. Anita ji. It is from 4 to 5 p.m. Subscribe to the baby care program if you're not a member yet, and don't miss the baby care program webinars. They are done by the experts who are very, very renowned in their fields. So thank you so much, everyone. So we couldn't answer everyone. So sorry. Please post them in the Ask Me session. Shilpa, Gayatri, and everyone are thanking you, Doctor, for this wonderful session.
Bye-bye.
Thank you, doctor. Thank you so much.
Bye.
Thank you.
Bye-bye.